Welcome back. I'm Mabel Jong, and this is day 2 coverage of the World Healthcare Congress in Washington, D.C. Thanks so much for joining us. In our studio right now is Dr. Ken Hopper, who is Regional VP at Anthem. Hi there, Dr. Hopper. How are you?
Doing great.
Well, a brief description of Anthem, please.
Anthem is a national insurer that represents both government business as well as commercial plans.
Okay. And you just participated in a panel today. Tell me some of the key takeaways that you had there.
Yeah, it was a very interesting panel with some very esteemed professionals that are working on behavioral and medical integration. And so the panel had some interesting points of discussion of which the audience really found that resonated with them. One of the major points was around behavioral literacy and recognizing that we're really bringing out the fact that we don't have a common language of talking about behavioral health, particularly understanding at the patient level or even at the provider level. And so we recognize that one of the major tasks that we have, particularly myself as a psychiatrist, is helping to propagate behavioral literacy.
Mm-hmm. Are you finding that the stakeholders are on the same page in terms of their goals?
Yes, I think for the most part, that I think that patient outcomes is the major driver, trying to be able to help individuals who are having difficulty getting traction because they have behavioral health or substance use issues is a major goal for almost everybody who is in the room.
I see. Now, this is not this is your first time at the meeting this year.
Correct.
What are you finding is valuable about this conference?
Well, the conferences, the segments and the discussions are actually very valuable as it relates to hearing how others are dealing with the sets of problems that face American healthcare. In addition to that, simply the networking, being around colleagues who are who I can have casual conversations about a variety of topics has been very valuable.
Okay, Dr. Hopper, thank you so much for your time. I really appreciate it.
Very welcome.
And I'm Mabel Jong. Thanks for watching. More interviews to come.